You know that feeling when something just completely unexpected and maybe really overwhelming happens. Like maybe you witness an accident or get some truly shocking news and it feels like your whole system just floods.
Yeah.
A sudden, really intense reaction.
Yeah.
That immediate, almost physical response is what we're diving into today.
Exactly. We're doing a deep dive into acute stress reaction, or ASR as it's often called.
ASR.
We've been looking through some materials, specifically Hayuha, Vitam, Lihom, C.pdf, and some related images, to really get a handle on this immediate psychological response, the kind that happens when you're faced with something exceptionally stressful.
And for you listening, this isn't just about learning a clinical term.
Not at all.
Our goal here is to give you a clear understanding based on these sources of what ASR actually is, what it might look like, and maybe most importantly, how you can actually help someone if you see them going through it.
Yeah, the practical side.
All right, we want to pull out those key insights without making it too complicated. Okay, so to start us off, how do our sources actually define acute stress reaction? What are the main characteristics?
Well, what's really noticeable in how the sources talk about ASR is that it's described as transient. It pops up as a direct, intense reaction to an event that's just overwhelmingly threatening or even catastrophic.
Okay, so transient means it doesn't last forever.
Precisely. Think about situations like a really bad car crash or witnessing violence or getting news of a sudden death. The key thing here is how exceptional the stressor is.
So way beyond everyday stress.
Exactly. It's outside the scope of normal challenges. It's a response to something truly, out of the ordinary.
Got it. So it's that immediate, really powerful jolt you feel when something extreme happens. That makes sense. It's like your normal stress response just gets cranked way, way up.
To an almost unbearable level, yeah.
So if someone is experiencing ASR, what might we actually see? What symptoms or manifestations do the sources point out?
The sources detail a pretty quick onset of different kinds of symptoms. Emotionally, you might see really intense fear or overwhelming anxiety. Sometimes even a kind of emotional numbness, like the person's detached.
Detached, okay.
Cognitively, there could be confusion, maybe disorientation, trouble focusing their thoughts, sometimes even a sort of distorted view of reality. It's like their mind is just struggling to process the sheer scale of the event.
That feeling like things aren't quite real, maybe? It's surreal.
That's exactly it. And the body reacts very strongly too.
Physically.
Oh, yeah. Physical symptoms can include a racing heartbeat, sweating a lot, trembling, maybe shortness of breath, nausea, dizziness.
Wow, okay.
Behaviorally, someone might get really agitated, restless, or they could do the opposite, withdraw completely, shut down.
Right.
The sources also mention something called dissociative symptoms.
Dissociative, what does that involve?
It can mean feeling detached from their own body, almost like they're watching themselves, or having a sense that the whole situation unfolding isn't actually real for them. It's a very intense, multi-layered reaction, mind and body.
That really paints a picture of just how totally overwhelming this experience must be. And it sounds like these symptoms show up pretty fast after whatever triggered it.
Very quickly, yes.
So based on the sources, how long does this usually last? Is it just a brief moment or does it tend to stick around?
The sources really emphasize the short duration of ASR. Typically, the symptoms pop up within minutes, maybe hours after the event.
Okay.
And they tend to decrease within a few days. Usually, they resolve completely within a month at the most.
Within a month.
Yeah, and that's a key thing that separates it from, longer-term stress disorders like PTSD. ASR is acute. It's that immediate surge. And for most people, it usually settles down reasonably quickly.
Okay, so intense, yes, but typically not something that goes on for months and months. That's an important difference. Now, do the sources give any clues about why maybe one person might react more strongly than another, or what factors might influence how severe the ASR is?
That's a really interesting question. The sources touch on it, but maybe in a more nuanced way. They don't give, a checklist of who's more prone to it.
Okay.
But the definition itself, calling it a response to an exceptionally threatening event, kind of suggests that the sheer size of the stressor is the main thing.
The event itself.
Right. It implies that an event like this can just overwhelm anyone's usual ways of coping. Things like how sudden it was, how directly the person felt threatened, feeling helpless maybe, or having no control.
Yeah.
Those could all play a part in the intensity.
Hmm.
But the main focus in the sources seems to be on just how extraordinary the event itself is as the trigger.
Right, so it's less about maybe pre-existing issues and more about the sheer impact of the event being so far outside what we normally deal with. That makes sense.
Yeah.
Okay, this is all really helpful for understanding what ASR actually is, but getting back to what our listeners really wanted to know. What practical advice do the sources give? How can someone actually support a person who's going through ASR?
Yeah, this is where it gets really practical. Although the sources are mostly about defining and describing ASR, they do kind of point us towards ways to help.
Okay.
Given that intense anxiety and potential confusion, creating a sense of safety and calm seems absolutely vital.
Safety and calm. Makes sense.
Reassuring the person that their reactions, however intense they feel, are understandable,
Yeah.
normal even, given what happened, that can be really helpful, validating those feelings.
Just acknowledging what they're feeling, saying it's okay to feel this way without judging them. That's step one.
Exactly. And encourage them maybe to focus on immediate safety, basic needs, simple things.
Like what?
Like maybe moving to a quieter spot, if possible, offering a glass of water, gently suggesting some simple breathing exercises to help kind of calm the physical side down.
Right, those grounding things.
Yeah, those seemingly small grounding actions can make a really big difference right in that moment. And it's also important, the sources imply, not to push them to immediately talk about the whole traumatic event in detail.
Oh, okay. Why not?
Because it could potentially be re-traumatizing, making them relive it when they're already overwhelmed. The focus should really be on the present moment, helping them feel a bit calmer and more in control right where they are.
That's a really crucial point. Don't force them to recount the trauma straight away.
Yeah.
Just be there. Offer that immediate, tangible support. What else should we keep in mind?
Patience. Definitely patience and understanding. The person might be all over the place emotionally or having trouble thinking clearly, so speaking clearly, simply, that's essential.
Keep it simple.
Yeah. Offer practical help with immediate needs. And if you can, maybe help them connect with their support system, friends, family.
Right, connect them back to their people.
Or even guiding them towards professional help if the reaction seems to be going on too long or if it's really severe.
So knowing when to maybe suggest seeing a doctor or a therapist.
Exactly. The sources subtly point towards getting a professional assessment if symptoms don't ease up after a few days, or if they're really stopping the person from functioning in their daily life.
Okay, so it's about providing that immediate comfort and practical help, but also keeping an eye on whether something more is needed down the line.
Precisely. The main goal right after an exceptionally stressful event is just to help the person feel as safe, grounded, and supported as possible while their system starts to recover from that huge shock. And knowing the signs, knowing what ASR looks like, helps you respond with empathy and give that immediate care that can really, truly make a difference.
Okay, let's try and boil this down then.
Yeah.
Based on our look at these sources, what are the absolute key takeaways about acute stress reaction?
All right, so in a nutshell, acute stress reaction is that immediate, intense psychological and physical response to something exceptionally threatening or catastrophic.
Immediate and intense.
Symptoms pop up fast. Intense fear, anxiety, confusion, trouble concentrating, plus a whole bunch of physical stuff.
Right, the whole package.
But importantly, ASR is typically short-lived, usually gets better within days, maybe up to a month.
Short duration. Key point.
And when supporting someone, the big things are create safety and calm, reassure them their feelings are valid, focus on immediate needs, speak simply, be patient, and know when professional help might be needed.
So it really comes down to recognizing that initial shock, helping the person feel grounded right then and there, and staying aware if they need more help later on.
Yeah.
This has definitely given a much clearer picture of that, often really scary initial reaction to extreme stress.
Yeah, and if you kind of zoom out for a second, understanding ASR really highlights both how resilient the human mind can be, but also how vulnerable it is when faced with something truly catastrophic. Recognizing this acute response means we can offer better, more compassionate support right in those critical first moments after a trauma.
Absolutely. And knowing how to respond well in those early stages could make a huge difference in someone's experience and how they start to recover. So for you listening, maybe something to think about is this. In a world where, let's face it, unexpected and intense things do happen.
Unfortunately, yes.
How can we, just as individuals or even as communities, get better at spotting these initial signs of acute stress in people around us? And how can we offer that crucial, immediate support and understanding? It's a powerful reminder, I think, of just how important our shared humanity is when things get really tough.